Sexual dysfunction following prostate cancer radiotherapy. A huge issue after prostate cancer radiotherapy is sexual dysfunction. Don't become the X in sex. What are your options to help mitigate this side effect? The sad truth is that there is no consistency in prostatectomy aftercare. The truth is that all men become impotent for a period of time, usually 12 to 18 months, with a few only recovering in 6 to 12 months and some 50% never recovering. Urologists will often prescribe Viagra or Cialis, which has very limited impact. The average man wants his urologist to help him back to his before surgery self. The urologists move on to the next patient unless they have a team that actually assists these patients with how to regain their manhood. There are so many different methods to retrain a muscle who now feels abandoned, but where do you start? The phallus is a muscle that left alone will atrophy just like a muscle around a broken bone. The phallus will engorge itself 3 to 6 times per night with normal physiology. You don't have that any longer, so this involuntary method is no longer working for you. The hormone therapy breaks the mind to phallus nerve pattern, further reducing stimulation. The androgen deprivation therapy also damages the lining of the phallus, causing scar tissue to form, reducing its ability to stretch. You are left with vacuum pumps to help stretch it, along with various electronic masturbation devices, which will all work to a degree in oral sex. It is recommended that to keep the phallus in good health, phallus injections should be given at least once a week and preferably twice a week. To get great erections. This sounds horrible, but I personally have given over 2,500 of these, and they not only work but can save, and do save, marriages. The eventual recovery is greatly improved with far less impact to a man's thoughts of self and his relationships. Unfortunately, most men just wait around to see what happens. They think that it is all over and nothing will ever be the same again. As they have watched doing nothing, their phallus shrinks and becomes totally unresponsive. Men, it does not have to be this way. You are the master of your destiny. Yes, you have been damaged, but I have described useful ways you can help yourself, and it is better when you involve your partner. You must embark on a journey of self-support when your body is unable to do it. You cannot wait, as your body will no longer help you and your future life depends on you. By whatever process you develop TD, time is your enemy, as atrophy and scarring will carry on. This to most men is very important, so don't waste your time on Viagra or Cialis if they don't work for you. The needle used in the phallus is tiny and will make the difference like night and day. Talk to your neurologists about what I have said, and if they are honest, they will agree. There is a process of finding the right dosage, but that is true with most medications. The drawback, which is dangerous, is that you can get an erection that lasts for several hours and is quite painful, called a priapism. I have another article on that, and must be dealt with quickly as you don't want to damage yourself. This takes an intervention. The process of learning to give yourself the right dose is not difficult but very important. It is really not painful, and to see your body's reaction is just wonderful. The time to start your rehabilitation is as soon as you are able, usually after a couple of weeks of normal recovery. Remember, your libido will be low only to get lower if you don't help your body to recover. Kegel exercises can also be implemented to strengthen your muscles damaged in the surgery. Kegel muscles are the ones that can stop your pee when you bear down on them, so practice. All of this is not done in a vacuum. You have a caring partner. Discuss your fears, needs and objectives, and they will help you to get through this. Your partner can help you through every step outlined in this video, and it is also to her or his benefit as well. Many men will fail on this journey because of fear, so become fearless. We wish you all the best on this journey. Subscribe, like, and share. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.